Hello, my name is Matthew Wong. I'm a student at Capilano University in psychology, and I'm going to present two studies on the etiology of schizophrenia that have to do specifically with the working memory. So, when we talk about schizophrenia, we're talking about a mental disorder that is characterized by severely disordered thoughts and processes and hallucinations. But specifically, a lot of people that research this disorder categorize symptoms into two, positive and negative. And this just means that if they're positive, they're going to add something to the what's considered normal behavior. That's the mean of behavior that the majority of people have. And the negative symptoms means that they're taking something away from the normal behavior that we will have. So some examples of the positive ones are hallucinations, hearing voices, paranoia, or having delusions. The one that we're going to focus on today is the impaired memory. That's part of the negative symptoms, alongside being unable or having impaired emotional expression, decrease of speech, and motivation. That will come a little into play into the second study that we're going to talk about, but mainly we're focusing on impaired memory. Also, there's three factors that increase the risk of developing schizophrenia, which are genetics or neurotransmitter regulation dysfunction, and also it could be because of brain abnormalities that have to do with the amount of mass that's on certain parts of the brain. But we're not going to focus on that today. Now, when it comes to research, there's broadly, well, we could say two types. One is empirical. Both studies that we're going to talk about are empirical, meaning that they develop their own scientific research, they gather their own data, and then draw conclusions from it. There's many other types of research that you can do, like reviewing a lot of research and drawing conclusions from them, or just being descriptive about an issue and then drawing conclusions from that. But we're going to focus on the empirical ones. So the first study was published in a magazine or a journal called Brain Imaging and Behavior. Now, the editor in chief of this journal is Andrew J. Sakin, and he's the director of the Center of Neuroimaging and Indiana Alzheimer's Disease Research Center. He's also a professor of radiology and imaging science, and also gives lessons in psychiatry, neurology, and other stuff that has to do with genetics. So this journal has to do a lot with studies that use, for example, MRIs, PET scans, or EEGs to see how the brain is functioning, what happens in certain mental disorders, and then doing research about it. So the title of this study is the Prefrontal Disconnectivity Links to Working Memory Deficit in First Episode Schizophrenia. And we're going to talk more about that. Now, the key terms to understanding this study is, well, first of all, working memory. So they're talking about this symptom that affects schizophrenic patients and is associated with dysfunctions in certain parts of the brain. So we will be using these three terms a lot in this study: the dorsolateral prefrontal cortex, the dorsal anterior cingulate cortex, and the ventrolateral prefrontal cortex. And well, we'll talk about this later. So the aim of the study was to clarify how these three regions contribute to a deficit in working memory. So patients with schizophrenia are believed to have weaker connectivity. We're going to talk about how they measure that later on, but that was their hypothesis. So we're going to talk also about the participants, but they had a FES group, that is first episode schizophrenia group, and a control group of healthy individuals. And they measure their brain activity during a simple memory exercise to draw this conclusion. So the tools that they used was, one of them was a dynamic causal modeling, and this is to identify causal influences of one neural system on another. So basically how one system is communicating with another. And for this, they use what they call a resting state functional magnetic resonance imaging, while the participants were performing the memory exercise, which was a simple two-back working memory test that I'll talk about later. But first, a little about the participants. So both groups had an average of 24 years, more or less. And overall, they had the same education. For the control group, 12 males, 10 females. The first episode schizophrenic group had 7 males and 13 females. So more or less the same. Now they took the patients from the Department of Psychiatry in Renmin Hospital of Wuhan University. And they had certain requirements to avoid confounds or other factors influencing their results. So they wanted to use first episode people because they hadn't had that much exposure to treatment. They haven't taken that many medications, but they also had to meet the DSM-4 criteria for schizophrenia. Their illness had to be 2 years or less in regards to duration, and they shouldn't have any history of other neurological problems or head injuries that could explain their memory issues, right? Also, drug and alcohol abuse. If they were doing this, then they were going to be rejected for the study. Now, the method or how they did this is that while they're doing the resting state MRI, they gave them some head padding and some earplugs so that they could like avoid distractions and that they could be comfortable and just focus on the working memory exercise. So this was just a series, well, 6 series of two back working memory segments, and they gave some instructions in between. So just like this image, you would see a number, series of numbers. Each number will be on the screen for 1 second, and in between it will be a pause of 0.5 seconds. And then every three, they would just ask you if the number was the one that you saw 2 numbers ago. And then you would just press a button of yes, no. So based on this, they noticed a lot of irregularities in the connection of a lot of brain parts, but the most significant ones were the dorsal anterior cingulate cortex. When it was communicating to the dorsolateral prefrontal cortex, it was way more deficient in patients with first episode schizophrenia than with the control group. Also, even more significant was the dorsolateral prefrontal cortex, so the previous one too, to the ventrolateral prefrontal cortex. So from one to the other, they're already losing, or the connection is weak. And then from that one to the other one, it gets even weaker. So it's like a game of telephone that you play with your friends. So eventually the message just gets lost or is incoherent. Now, from this, we can conclude that working memory in schizophrenic patients is biological, you could say, or it comes from some lesions on the brain that doesn't allow for proper processing of memory functions. But there's also an emotional aspect of this. But that's where the second study comes into play. So the second study was published by the Neuropsychology Journal that is published actually by the APA, the American Psychology Association, and it's very recent. It's from this year. This one has two editors. The former one was Keith Owen Jeeves, and the one who's currently sitting as the editor is Stephen Paul Woods. You can see their positions. And this one focused on empirical research as well, as we were talking about. But this is more about the brain and the behavior. How are they connected? So the previous one was more not scientific, but it based it on MRIs, EEGs, and other more formal studies that you could do, like things that you can see. But this is trying to find a connection between the brain and the behavior and how that affects cognitive functions and emotions. So this study has two experiments. The first one is not so relevant, but I think it's worth just mentioning briefly. And the second one is the one that really ties to the whole thing of the working memory. So experiment one was conducted to know if schizophrenic patients had a deficit in long delay recognition memory. But when it came to pleasant or unpleasant stimuli, in contrast to just neutral ones. They use visual stimuli because it is known that people overall have better visual memory, so to speak. So if they see something, it's more likely that they will remember it overall. Of course, there's exceptions. And they wanted to also delay it in a way as to compare it to clinical interviews. So you go, you get a clinical interview, and then you wait like a week, and then you have another clinical interview. So they wanted to mimic this time. So they came up with three hypotheses that there will be no difference between the groups in their self-report emotional experience of the visual stimuli. So pretty much like everyone should feel the same way about the images that are going to be shown. And I'll talk more about that later. The second one was the schizophrenic group have a deficit in recognition memory of pleasant stimuli in immediate and delayed tests. So basically that they wouldn't be able to recognize the images that have something pleasant. And the third hypothesis was that schizophrenic people with greater severity of anhedonia or lack of feeling emotions, positive ones, established by clinical tests, have impaired recognition memory at immediate and delayed tests. So basically, the more severe that your anhedonia was, the worse your memory when it comes to pleasant things would be. So let's see, for some details about the participants. The schizophrenic group was 63% male, 37% female, 95.8 were white, and 4.2 were other. Not specified, but other. And 96.4 of them were taking prescribed antipsychotics. Of the control group, they were all white, 61% male, 38.9 female. Now, similar to the other experiment, they had to meet some criteria. And the first one was that English had to be their first language. And that explains why there's so many white people. Then the second one was that, similar to the other one, the history of brain injury or other medical conditions was not there. So if you had a medical condition or a neurological problem or brain injury, you could not participate. And also the substance abuse, but in the past 6 months. Funny enough, this study was done in Las Vegas, so that's why maybe they say like, well, in the last 6 months, because of how common it is to consume substances in that place. So the tools that they use were a lot of tests, basically. So the first one was the brief negative symptom scale. So that is just to assess their anhedonia because of their hypothesis three, they would need to evaluate how severe it was. Then the Calgary Depression Scale for schizophrenia was done before the experiment was done, just to measure their current depression to reduce the compounds. Then also to see how their intellectual level was, they did the Wechsler test for adult reading. And the test itself, the thing that had to do with the pleasant images or neutral stimulus, is called the International Affective Picture System. So it has 10 pleasant images, 10 unpleasant ones, and 10 neutral ones. And we'll talk about how they did it. So it came in phases. The first phase is that they just had to rate how positive the stimulus made them feel. And after that, the second phase would be to make an immediate recognition memory test with 30 foils. And what that means is that it had the 30 images of the test, but it also had 30 fake ones, or that they were not there. So they were testing if they could recognize the ones that they had done. And the phase three was when they did the recognition memory, the same thing, but after 1 week. And the only thing that they changed is the foils. They still kept the 30 ones of the test, and they just added 30 different ones. So from this, we'll see the results. The schizophrenic group reported more negative emotions toward neutral stimuli compared to the control group. And if the anhedonia was more severe, they reported fewer hits with pleasant stimuli after the immediate testing and after a week. So before going into the second experiment of this study, what this shows is that overall schizophrenic people tend to view things more negative. So even if something is neutral, they would just say that, well, that still is kind of unpleasant. So for the second study, second experiment of the second study, there were a little more races involved in this. Like 51 was white, over half of it, and then 37% black, 5% Asian, 4 Latinos, and 3 like other. 64 males and 37 female. That's in the schizophrenic group. And 94.8 of them were prescribed antipsychotics. Their test scores were different. 76.7 was the mean score for the schizophrenic group. And for the control group, their mean score was 97.4. So overall, the control group, you could say, was a little smarter or could read better. And in the control group, it was similar, not much difference in between the sex, 61 male, 38 female, and more or less the same races, 48 white, 30 black, 5 Latino, 8.3 other. So the same criteria of the previous one was followed here. That if you have injuries or if you're abusing substances, you cannot participate on this one. Same thing. But on this one, they had different hypotheses. So this one has to do with the memory. So the previous one too, but it was like to see if they pay more attention to certain stimuli of how they rate it. But on this one, they were hypothesizing that, well, the control group will recall more the positive words than the schizophrenic group. And the second thing will be on the schizophrenic group, the emotional memory deficit was thought to be regarding the retrieval aspect. So not to get too much into the memory, but well, we learn something, code it, and then afterwards we retrieve it. So they believe that the deficit is in retrieval. And if we go back to the first study, well, they could see that there was an issue with the connection between certain parts of the brain, and that could explain this retrieval aspect. But we'll see what the results are. The third hypothesis was that the higher the anhedonia levels, the lower the recall for happy words would be. So how they did this, they basically did the the test that I mentioned previously, just to assess how they were in the moment of the testing, if they were not like too depressed. They did the intelligence thing, and then they used the emotional verbal learning test in this occasion. So for this one, there's 16 words, four for each of the categories. So it's happiness, sadness, anger, and anxiety. So four of each. So what they did was 5 immediate recall single trials. So they just gave a list of the words, and then they gave a interference list consisting of 16 words that are not included. So it's very similar to the previous experiment, but this time with words instead of the images. Then they did the short delay free recall and the short delay emotional category 2 recall of the target list, or the list of words that have to do with the emotions. And after 20 minutes, they did the long delay free and Q recall of those words. And then they did the recognition part, which should be like, do you recognize this? Yes or no. So basically, they wanted to see how many words they could recall, and then afterwards, if they could recognize. Their results, well, overall, the control group did better, but I'm going to focus on the happiness words because the control group had much better recall of the happy words than did the schizophrenic group. As you can see here, the trial 1 to 5 is just bigger because it's 5 trials in one bar, but pretty much it's the same. The control group is always performing better. And also individually, if they had higher anhedonia that they tested before this, then the recall for the happy words were worse. So what we can conclude from both experiments is that the problem of working memory has to do with a malfunction in the connections of parts of the brain, but it also has to do with the individuals having anhedonia or responding less to positive stimuli versus negative stimuli. That was kind of the point of the first experiment, that they proved that people with schizophrenia tend to rate every stimuli more negative, even if it's just neutral. And then when it comes to recall, they would recall happy things worse. So not only their working memory is impaired, but also what are they remembering, which is bad because it just adds to the problems that they can suffer, right? Not only they have issues remembering, but also the things that they remember are not that positive. So I hope that this was enjoyable, that you learned something about the working memory in schizophrenia, the etiology of why it happens at a brain level, and also what it means as an individual with this disorder when it comes to your everyday life. Thank you for listening.